Hi everyone, I want to talk about Tamiflu or Oseltamivir. Okay, Oseltamivir or Tamiflu. But let me make a disclaimer from the onset. I'm not an agent, to sell this particular medication, but I'm just about to talk about a good medication that I'm familiar with when it comes to flu infection. Okay, Oseltamivir with the trade name Tamiflu. Let's go. Tamiflu is useful as for both prophylaxis and treatment during exposure or outbreaks. It's used for people with high risk of influenza complications, and those will include the individuals with decreased immunity, group home residents with co-morbidities, exposed persons to infected individuals, the pregnant women, the obese, or anyone on immune suppressing medications. The dose for prophylaxis is 75 mg per hour once daily. Okay. As per the duration of the treatment while using Tamiflu is usually between 5 to 7 days, but affected individuals could be on it for a greater period of time if there is institutional outbreaks, when all residents will be given Tamiflu regardless of vaccination status and for weeks and at least 1 week after the last case or cases. Also, individuals with severe illness could be on Tamiflu for a longer period of time, as well as immunocompromised people. Post-exposure should take about 75 mg per hour twice daily for 5 to 10 days if hospitalized. For prophylaxis, Oseltamivir 75 mg per hour once daily is good enough. Tamiflu 2 inhalations once daily is also nice. I'll talk about Tamiflu in a separate presentation after this. Baluzavir is not used for prophylaxis, and Peramivir is not used for prophylaxis as well. For treatment, you can use Baluzavir 40 to 80 mg per hour start. So you give it only once. And you can use Tamiflu 2 inhalations twice daily for 5 days. Peramivir is 600 mg intravenously once. And Oseltamivir can use 75 mg per hour twice daily for 5 days. You adjust the dose based on creatinine clearance, because if there's renal impairment or on hemodialysis or peritoneal dialysis, you have to adjust the dosage. The Tamiflu is given as 75 mg per hour twice daily for individuals greater than 40 kilograms. To those within 23 to 40 kilograms, 60 mg per hour twice daily is good enough. And for those with lighter weight, like 15 to 23 kg, you go for 45 mg per hour twice daily. For children less than 15 kg, you go for 30 mg per hour twice daily. And for infants, 3 mg per kilogram per hour once daily is good enough. The timing or the coverage, it should not be more than 48 hours after the onset of the symptoms. Let me explain that. For Tamiflu to be effective, make sure this individual has not started the onset of symptoms more than 2 days. If it's more than that, the rate at which you'll be able to clear the virus would decrease. And treatment in anyone greater than 2 weeks is fine. Prophylaxis in anyone that is greater than 1 year is okay. and it covers influenza A or influenza B. The only contraindication is hypersensitivity to Tamiflu or Oseltamivir. What are the possible side effects? Yeah, you can have headache, nausea, vomiting, pain, agitation, anaphylaxis on account of which you'll be promptly attended to, arrhythmia, confusion, delusion, dermatitis, and if you are an individual with diabetes mellitus, it's going to worsen the situation with increased glucose level. Also, as side effects could be facial edema, gastrointestinal tract bleeding, hepatitis, toxic epidermal necrolysis, Stephen-Johnson syndrome, seizures, nightmares, decreased level of consciousness, and hallucination. And with that, I've come to the end of presentation as far as Oseltamivir is concerned. My next presentation will be on zanamivir, that is Relenza. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you.